You're watching Cetome TV. Knowledge is power.
Next question comes from Misha. I've been told we are watchful waiting my lymphoma. Should I still get treatment?
That's a great question. I don't believe in watchful waiting. I think there's always a solution. There's always something you can do. If you have cancer, watching and waiting is in a sense turning you into a petri dish.
Waiting to see if
it grows, and then they can say, "Oh, guess what? We know now that you have cancer and you have a few months to live."
Well,
I would definitely pursue some sort of. I would, definitely pursue PET CT, and I would get your previous biopsy sequenced.
Okay.
Very important.
Right. So this means perhaps then, Misha, going taking matters into your own hands to gather more accurate diagnostic data, like the PET CT scan and like some genetic testing if you've had a biopsy, and even if you haven't, there are some liquid-based ones. That's what you're saying. Hey, something like that, so that you can have confidence about what stage your cancer's at, where it's at.
And if you have aggressive mutations, that are likely going to increase the recurrence. Yeah,
or make things grow more rapidly.
Exactly.
That information, even if you have to go out on your own to get it, it does then, in essence, obligate your oncologist to treat you differently. It doesn't allow them to apply the watch and wait scenario in the same way.
Yeah. If you find the problem, they kind of have to fix it.
That's right. Yeah. So that's important. If you are going to stick with the watch and wait, which clearly is not recommended, then at very least make sure that they're assessing you regularly, not every 6 months or not once a year, which is very common in certain cancers to, come back, we'll have another CT scan and, in half a year or a year. A lot can happen in that period of time.
Yeah, a lot. Very quickly.
Yeah.
There's lots of, maintenance and adjuvant therapies that you could take too. So while you're in this so-called quiet zone waiting for the tumor to come back, there are drugs and treatment options.
Things you can do to help to either prevent recurrence
or
definitely slow how quickly it would come.
Exactly.
Yeah. So let's say I want something like that. How would I go? Would I have to go through these other, like PET CT, genetic testing, or is there some way I can get my doctor to?
That's a pretty open-ended question.
Is it?
Yeah, I can't answer that.
It depends on the case.
Every case is different.
Okay. Well, every case is different, which means that it might very well be possible to get your doctor to give you some of that adjunct therapy, but always your recommendation really is get the genetic testing, find out what's driving,
get the PET CTs, blood tests, everything.
Because that really does give you more data, and it makes sure your oncologist gives you the right treatment within a speedier period of time.
Yes, exactly.
Thank you for watching Cetome TV. Subscribe below and stay informed.